My name is Helen Newton, and my behaviorist biography is on Gina Green. Dr. Gina Green is a living legend, still very much alive and actively involved in research, policy, and practice of applied behavior analysis. Her research has shaped both ABA practice and policy and influenced how ABA is implemented today. She is the CEO of the Association of Professional Behavior Analysts, a nonprofit focused on advocacy, legislation, and competency within the field of ABA, which she helped found in 2007. She previously served as the president of the Association for Behavior Analysis International. Her research and advocacy has influenced policy that regulate, license, and certify behavior analysts, as well as the training, graduate, and doctorate level programs and continuing education required in the ABA profession. Author, advocate, collaborator, and innovator, words that describe Dr. Gina Green. Her work has been published in peer-reviewed journals around the world. She has authored books instrumental in ABA interventions and practice. Gina Green's work has an impact on all of us in the program. Gina Green's focus on policy and competency in practice directly impacts clinical practice of all behavior analytic professionals. The ABA Coding Coalition was created by collaboration of ABA organizations and the American Medical Association to define billing codes to carry out and regulate ABA services. Gina Green was the main representative for the Association of Professional Behavior Analysts, one of the organizations in the coalition. The ABA Coding Coalition is significant because the billing codes categorize treatment services for each individual receiving ABA services by type and cost. The billing codes provide insurance companies, Medicaid, and other funding sources the necessary information to pay for these services. This is important to us because billing for services is what pays ABA practitioners, which allow us to work and deliver services to clients. She also had significant leadership roles in ABA organizations. Gina Green has held leadership positions at ABA organizations that we already may be a part of or may join in the future, such as the Association of Professional Behavior Analysts, the APBA, and the Association for Behavior Analysis International, ABAI. These organizations promote collaboration, research, professionalism, and competency in the field of ABA. Dr. Gina Green also made significant impacts in ABA policy. The BACB guidelines are a framework for competency, but Gina Green argues they are not enough to engage in scientific practices and evidence-based interventions. Dr. Green urges all behavior analytic professionals to evaluate interventions and treatment through additional scientific measures to ensure the science of ABA is implemented throughout service delivery. She also had significant impacts in ABA policy and advocacy. One of the articles I reviewed, Johnston et al., 2006, examines positive behavior support, or PBS, which is the popular intervention for problem behavior used in schools and treatment settings nationwide. PBS uses aspects of the three-term contingency for behavior, but does not require the same training and scientific processes that ABA requires. PBS gained popularity when it was promoted through federal special education policy, specifically the Individuals with Disabilities Education Act, or the IDEA. The authors argue that ABA could gain popularity and accessibility on a wider scale by informing policymakers of the evidence-based benefits of ABA, such as data-driven effective interventions and the highly trained ABA practitioners. Gina Green also made significant impacts on ABA practice. Gina Green's work emphasizes the importance of competent, scientific-minded practitioners, evidence-based practices and interventions, as well as data collection. Most of Dr. Green's work was about interventions for children with autism. So in one of her works, authored with vets in 2010, discusses planning and intervention for a child with autism. So some of the things to consider based in the article was to use data to guide intervention by using assessments, observations, and as well as including the child's short-term and long-term goals. The goal of the intervention should be to improve the child's functioning and overall well-being. Another study that Gina Green was involved with found that intensive or 30 to 40 hours per week of ABA interventions were shown to be more effective in improving the functioning and daily lives of children with autism. Intensive ABA interventions were also shown to work better when compared to less consistent special education interventions, as well as non-ABA autism-focused interventions. So this is important for practice because we use all of these strategies to plan for an intervention when working with a child with autism, and many of the children that we do provide interventions to is on the intensive basis. So those several hours of ABA interventions per week to address problem behaviors, as well as helping those children learn to develop new skills. Stereotypy is vocal or movement behaviors that do not serve a specific purpose or function and are often repeated over and over. Individuals with autism may engage in stereotypies, as repetitive behavior is one of the defining characteristics of autism. So some of the children that we may work with autism may exhibit stereotypy in their behavior. So McDonald et al. 2007 found that stereotypy can increase significantly with age, especially if a child is diagnosed with autism. So this supports findings that ABA therapy for children 2 years or younger is effective intervention to improve outcomes. So that is why we see that when we encourage early intervention and trying to get children diagnosed early so we can get them into ABA therapy and improve their outcomes, as well as having the intensive services. So having lots of services at a younger age has shown to increase functioning and overall well-being for these children. And I'll end my presentation with my interview questions for Dr. Gina Green. If I can interview her, I would start with, how did you get your start within the field of behavior analysis, and what was your experience in the field as you started your career? Secondly, as a woman and a trailblazer in the field of behavior analysis, what is one challenge that you overcame during your career? In your 2010 publication, Training Practitioners to Evaluate Evidence about Interventions in the European Journal of Behavior Analysis, you discussed the pitfalls of pseudoscience and its unfortunate effects on the autism population. In recent years, there seems to be a growing popularity of the anti-vaccination movement that spreads misinformation about the effects of vaccines and the development of autism, though this has been disproven through scientific research. What can practitioners do to defend the science of ABA and guide families and individuals away from false information such as the anti-vaxxer campaigns? My last question would be, what advice do you have for novel behavior analysts working with children within the autism spectrum disorder? What are some ways that behavior analysts can advocate for the practice of ABA to reach more populations and communities worldwide? Thank you so much for listening to my presentation about Dr. Gina Green and how she has impacted what we do as ABA practitioners and what we will continue to do on our journey to become behavior analysts. Thank you so much.